Hey everyone, welcome to our webinar today with Milwaukee Prenatal Yoga Community. I'm very excited to have with us today Lauryn Beecher. She is returning to do part 2 of the pelvis in this time in birth and postpartum. Do I have that right, Lauryn?
That is correct.
Excellent. And I can turn it over to you if you want to start with like a brief introduction to yourself. I don't know if that's something that you start with, or maybe you save that to the end, but you're welcome to take it away with a short intro if you want to do that now, and you may begin.
Awesome. Well, as Heather said, my name is Lauryn Beecher. I am a physical therapist in the Milwaukee area, and I also co-own a yoga studio where we offer some prenatal classes. I've been teaching yoga for the last 5 years, same thing with my physical therapy practice. And that's just a little bit about me. And I'm excited to talk more about anatomy with everyone today as it relates more to birth itself and postpartum, some things to be mindful of injury wise, some common aches and pains during pregnancy, all of that good stuff.
Excellent. Well, I'm going to take me off the screen. Thank you. And then mute myself so you can have full control here. So let me stop this. All right.
Perfect. Okay, let me see if I can get the screen share going here again. We had a little trouble last time. Okay. Heather, can you let me know if you're able to see that there?
Yes, I can see your like the slides off to the left, and the first slide says introduction. Is that where you want to begin?
That is perfect. Okay.
Great.
So I already introduced myself here, so we can go ahead and keep things moving. As I kind of mentioned, today our goal is to go over some common pregnancy aches and pains, and then get into a little bit about the process of birth, mostly how it impacts the pelvis. We're not going to talk through like specific stages of labor or anything like that. I felt like that was a little bit outside the scope of this course, or at least my section of it here, and talk a little bit really about how we can use some of the common yoga postures and movements to build some awareness in the body as it relates to feeling how the pelvis moves, and also how the pelvis needs to open and close and shift for vaginal birth. We'll also very briefly talk about cesarean birth, as you may have some students who are planning a C-section, or they may have a baby that's breech, which are often delivered by cesarean. And then sometimes there is an unplanned C-section as well. So having a little bit of knowledge around what that surgery and recovery look like. We'll talk a little bit about breathing and how you can use the breath to help relax the pelvic floor, connect with the pelvic floor, how that relates to some pushing strategies, building on a little bit about what we talked through in part 1. And then we'll go over some just general knowledge around postpartum, in case that's an experience that you haven't had, you haven't been around a lot of people postpartum. Just acknowledging that everyone's postpartum experience is very different. So some just general knowledge around sometimes what can be expected postpartum, some ideas that you can throw out to your students on ways to just prepare for postpartum, as you may be the person that they are seeing on the most regular basis. And some little tips and tricks can go a long ways. So as I mentioned, just our goal here, understand some of the common areas of discomfort during pregnancy with some general tips on ways to modify if someone is experiencing those particular aches and pains, to then be able to explain how to connect your yoga practice or your movement practice with the pelvis as it relates to labor and birth itself. And then just gaining that little bit of extra knowledge about postpartum as well. So, starting off here with some of our common pregnancy aches and pains. The first one, which is one that many people experience during pregnancy, is pelvic girdle pain. So, this is kind of a catch all term. It's a very general phrase to describe really any type of pain in any of the joints of the pelvis. So, this can be in the front at the pubic symphysis. So I grab my model here just to kind of reorient everyone. We have our hip bones on either side, the pubic bone here in the front. So this little piece in the middle, that is the cartilage that makes up the pubic symphysis. So that's right where your two pubic bones come together in the middle. And then on the back here, where your sacrum meets your ilium, that's your SI joint or your sacroiliac joint. So pubic symphysis pain is often abbreviated as SPD. It's commonly referred to as lightning crotch, or if someone comes into your class and they're describing this pain in the front of their pelvis, they might say it feels like a bolt of lightning or it feels really sharp. Those are all good indicators that there is some type of dysfunction at the pubic symphysis or the symphysis pubis. So it's often incredibly extreme pain. It is honestly like quite hard to miss because it's a very specific area, and it's often irritated by taking large steps or going up and down stairs, things that we have the right side of the pubic bone and the left side. When you take a big step, things shear a bit at the front of the pelvis because all of those ligaments are a bit more relaxed. So the joints themselves are more mobile. So that's where we can get this shearing if I take a really big step, or feeling almost like a separation if I step my leg out to the side, like we often do when getting in or out of the car. So some little things to think about here when we are working with someone who has pubic symphysis pain during their yoga practice. They might not do well with a wider stance. Things like a warrior one, a warrior two, where they're in a little bit of a lunge position, that can be very similar to taking a big step, going up and down the stairs, where you're in that little bit of an asymmetrical stance and you're getting that pain in the front. So a more active practice where they're stepping forward, stepping to the side might not work particularly well for them. Instead, focusing on things that are a little bit more symmetrical. So can I stand in Tadasana with a really long spine? Feel that engagement throughout the abdomen. Can I work on my posture? Sitting back into chair. I'm not rotating. There's no shearing at the pubic bone. Activities like cat-cow, things where there's a little bit of that forward-backwards movement, but there's none of that shearing at the pubic bone. So just being mindful of avoiding things where the knees are both falling out to the side, or where there is, one foot significantly in front of or behind the other, as that can all be very painful. The one bonus with pubic symphysis pain is it does often go away as soon as you are no longer pregnant, and there isn't that additional pressure at the pubic bone. One thing that I do tell everyone that I work with who has pubic symphysis pain, though, is if you are planning on having more children, this pain often comes back quicker and more intensely with each successive pregnancy if you don't address why it happened in the first place. So this can be things like really tight adductors, really tight inner thigh muscles, an overactive pelvic floor, tense abdominal muscles, basically any of those muscle groups that attach to the front of the pelvis that we talked about in part 1 can be really big contributing factors here. So this is where their postpartum yoga practice can be tailored to things that might have caused them some pain or dysfunction during their pregnancy. So if I know that my postpartum yoga student had a lot of pelvic pain or pubic symphysis pain during pregnancy, we're going to add in things that help to stretch and strengthen the inner thighs, the outer thighs, the abdominal wall. That way, if they are pregnant again, especially if I know that they're planning on having more children, that next pregnancy, they feel much better than this current one. Because this is one condition that once it flares up, it is really tough to calm it back down if it's not caught right away. One thing to be mindful of here, when there is that pain in the front, if they mention it's pain with urinating, please, please, please recommend that they go and get tested for a UTI. I've had a couple of people that thought maybe it was the beginning of pubic symphysis pain, and sure enough, they had pain with urinating. There was an odor to their urine, and it ended up being a UTI. So just something to be mindful of if someone is mentioning pain at the pubic bone. Another very common area of discomfort during pregnancy is at the sacroiliac joint or the SI joint. So that joint in the back here, where the sacrum and the ilium come together. We have a lot of really strong ligaments, really dense ligaments that run through this area. And just like in the front, all of those ligaments become a little bit more lax and a bit more mobile. So if someone doesn't have particularly strong glutes, then that joint tends to be more on the mobile side. And that extra mobility can cause a little bit of a sharp or a stabbing pain. And it often happens with movement, where they go to change positions. It could be something really simple like standing up out of a chair or rolling over in bed, and they feel this sharp or this stabbing pain at their SI joint. Sometimes it happens on one side, oftentimes it happens on both. So thinking of how can I help this person make sure their glutes are mobile and strong? So many of our yoga postures that are standing postures, if we have good posture, good alignment, we're using our glutes. So thinking of the glute muscles as muscles that externally rotate and extend the thigh, how can I use that knowledge to build some strength in the glutes, whether it is holding chair pose, coming into a bridge, in our different warrior postures. I'm focusing on keeping my knee alignment. It's all glute work. A lot of our standing on one leg exercises can be very helpful as well, because we're helping to strengthen the glute med. It helps to provide a lot of support and force closure at the pelvis. So when we think about pelvic girdle pain, what we're really looking at is what's tense, what's tight, what's weak. How do we get things moving through a comfortable range? And then how do we build back that strength and support so that the muscles are doing the work of supporting the joints now that the ligaments can't do as much of that work? With both of these conditions, something simple like keeping the legs together, not allowing the knees to fall out to the sides or taking a big step out to the side as you roll out of bed or get in and out of the car. That is a typo there. Get in and out of the car, not get in and out of your core. Can be really helpful. So one tip that I like getting in and out of the car, if you just kind of hook your ankle underneath your heel or underneath your other ankle, it can be an easier way to keep those legs together, to then swing both legs out of the car and stand up, or first sitting your butt back and then swinging both legs into the car together. Can be really helpful in allowing someone to still be out and about and moving without as much of that pain. One other thing to keep in mind here, someone might be wearing an SI belt or a support belt of some kind. Sometimes it's helpful to remove those supports during gentle physical activity. That way you're giving your muscles the chance to support you and do the work of supporting your body. Other times when things are really flared up, it's helpful to have that passive support so that you aren't irritating things more as you're trying to build some strength and some stability. So there's no one size fits all here. And this is where asking a couple of questions so that you're able to give the right cues and the right guidance for your students can be really helpful. Next up, we have nerve pain. So I listed the 3 most common types of nerve pain that we see during pregnancy. The first, which I imagine many of us are familiar with, is sciatica. The sciatic nerve, it comes from the nerve roots, so where the nerves exit the spine, in the low back and the sacrum. Those individual nerves, they all come together to create this little bundle that is the sciatic nerve. That sciatic nerve runs through the glute area, underneath the butt bone or the sit bone, and then down the back of the leg. Kind of a fun fact, the sciatic nerve is one of our thickest nerves in the body. It's actually about the width of a pencil. So when it's really irritated, sometimes people will feel that like pencil-sized structure underneath the glute area, and it feels really sore and it feels really tender. So if someone is describing pain down the back of their leg, that is likely sciatica, or it's related to something that's going on with the muscles in that area of the back where the nerve roots come off of the spine. One thing to note here is that people will often call any type of leg pain sciatica. So again, teasing things apart a little bit of, well, how would you describe the pain? Nerve pain is often numbness or tingling, feeling a little bit of a like pins and needles type of feeling. So if someone's telling me that they have sciatica, but what they're describing is, oh, well, it's really achy and it's really sore, then I'm going to think, that doesn't sound like a nerve to me. That sounds more like a muscle. Muscles tend to be sore and achy. Nerves tend to have some numbness, some tingling, pins and needles, sometimes a more shooting sensation. So with sciatica, I'm looking to see how can I help this person get their hips moving, build back some strength in the low back and around the glutes so that I'm supporting the spine and the pelvis, versus if someone's describing this muscle ache down the back of their thigh, I'm thinking more about their hamstrings. So what can we incorporate to, again, build strength and mobility, but focusing a little bit differently than I would for sciatica? Next, we have carpal tunnel. So something that many of us are familiar with, especially if you have ever been in a role where you do a lot of typing and maybe you didn't have the best ergonomic setup, the best setup at your desk. So the carpal tunnel, our carpals are the bones in our hand. So the carpal tunnel is referring to this little tunnel right in the area of the wrist. We have a nerve that runs through that area that is held in place by, again, a ligament and some connective tissue. So during pregnancy, as we talked about in part 1, the blood volume increases a lot. And this can result in some swelling, especially if someone's just also retaining a lot more water. So people are more predisposed to developing carpal tunnel during pregnancy because that little tunnel is more easily compressed. So one thing to pay attention to here is, are they noticing numbness and tingling just in one hand or both hands? Can I also think about where those nerves come from? Those nerves, they travel all the way up the forearm, all the way up the upper arm, and they pass through the pecs and the collarbone and upper ribs. So when we think about posture during pregnancy, so often everyone is collapsed forward, especially as the baby grows or if the breasts are larger. So if I can first start by opening everything up throughout the chest, I'm creating a lot more movement for the nerves all the way down the arms. One thing to be mindful of here, again, is that numbness and tingling. For some postures where someone is in a hands and knees position or their hands are on the floor and they're using them for support, I may need to, instead of having someone have their hands flat, I might recommend that they come up on their fists. If I have dumbbells available to me, I might say, let's grab some light weights. That way, instead of having your palms flat on the mat, you can hold the dumbbell and have your wrists in a little bit of a straighter or a more neutral position. Moving on to meralgia paresthetica, which is just kind of a fun word to say. This is describing a compression of one of the nerves that runs on the outside of the hip and thigh. So this is where when someone comes in and says, oh, my sciatica is killing me, asking some questions around, well, where do you feel your sciatica? What does it feel like? Because if they tell you it's on the outside of their hip and thigh, or they mention, when they wear leggings that are a little bit tighter or more compressive, if they're wearing a belt, things that could compress that area on the outside of the hip or on the outside of the thigh, and that's when they feel this pain down their leg, this is more likely the scenario over a traditional sciatica. So the symptoms are often similar. It feels burny, tingling, numbness, that pins and needles feeling. As I mentioned, it's often worse with compression, and it often feels better when you're wearing more loose clothing. So that can be a very simple tip that someone in your class would greatly appreciate to help resolve that burning or that tingling. We also want to think about the way that those nerves run throughout the body. So if someone is having that burning, tingling, numbness feeling on the outside of their leg, I want to see what can I do to gently stretch their hip flexors, the muscles on the outside of the thigh, the outside of the hip, to allow for more mobility throughout that area. As that area becomes more mobile, again, we're working on strengthening. Those muscles, they had to tighten up to provide some support to the pelvis. So if I can get them moving and then I can help them be strong, they won't need to be so tense and tight to try to hold everything together. Next up, we are talking a little bit about the trunk and the abdomen and common areas of pain and dysfunction throughout that region. So a very common one is round ligament pain. The round ligament runs from the pubic bone to the uterus. So as the uterus grows and expands, that ligament that runs right through here, it starts to stretch. For some people, as that ligament stretches, and there is one on each side from pubic bone to the front of the uterus, it can become quite painful. Oftentimes, people will notice this during their first pregnancy, right around 20 weeks, 22 weeks, when things are starting to stretch enough that they're feeling some pulling, they're feeling some tugging. For some people, that resolves pretty quickly. The ligaments stretch quite comfortably. Other times, it can feel like a really deep, achy, throbbing pain. It's always in the lower abdomen. Sometimes it's just on one side, sometimes it's on both. So that can vary a little person to person. Um, so when we think about yoga here, we want to avoid things that intensely stretch the abdomen, as intensifying that stretch with any type of leaning back or bending back can be quite uncomfortable. Instead, we want to focus on postures that relax the abdominal wall. So, can I move through some gentle cat cow? So it's still a little bit of a back bend. I'm still arching, but it's much different than standing in Tadasana and opening your chest up towards the sky. It's much softer, much more gentle. You're supported by your hands and your knees. And I can focus on allowing the abdomen to soften as I'm extending or arching a little bit versus my abdomen needing to work to really support me as I stand and arch back. So some little ways to get some gentle movement in to relax all of those abdominal muscles, provide some gentle stretch versus a very intense stretch to the round ligament. Rib pain is another very common area of discomfort during pregnancy. And it's often related to our posture. So when we think about pregnancy, as the baby grows, the uterus grows up and then at a certain point typically tips forward. So as the baby grows and everything presses up, it can shift the ribs up and out. So if you've been pregnant or know people that have been pregnant, you might notice that a shirt that you wore all the time, it just doesn't fit quite as well in the rib cage anymore. It feels a little bit more on the tight side, even if other areas of your body feel quite similar to the way that they did pre-pregnancy. So as the rib cage shifts, or if the baby is in a particular position where they keep kicking or punching their ribs, this can certainly be an area of discomfort. So being mindful of, can I work on some gentle side body stretches and some rotation where I open to allow the ribs to continue to move and to create that space that is so very much needed. Diastasis or diastasis, also diastasis recti, diastasis rectus abdominis, DR or DRA. Basically, there are a lot of words and a lot of acronyms that are all describing the same thing. Diastasis or diastasis is what happens for the vast majority of people towards the end of pregnancy. So when we think back to our anatomy, we have a couple different variations pictured here. But on either side, we can see the rectus abdominis, those six-pack ab muscles running on either side. Got belly button there in the middle. And we can see this thin line. That line is called the linea alba. And during pregnancy, there comes a point where the rectus abdominis, those abdominal muscles, they just can't stretch anymore. So the connective tissue in the middle, the linea alba, starts to stretch and thin. That thinning of the linea alba is diastasis or diastasis. It can occur in all different areas of the abdomen. Most often, we will see diastasis, diastasis right around the belly button, right above it, because that's an area of tissue weakness. We'll commonly see it extend up towards the breastbone or the xiphoid and down towards the pubic bone as well. So if I am asking someone to move a certain way or hold a certain position, and I notice that when I look at their abdomen, I see a doming or a coning shape, instead of just being that typical rounded abdomen, rounded pregnant belly, something's a little distorted. It's tenting, it's popping up. That can be a good indicator that someone has diastasis recti, or they're going to start developing it sooner rather than later because they aren't using their abdominal muscles well to support them. They're letting that extra force and pressure kind of escape through the front of the abdominal wall. So with diastasis, it is a natural part of pregnancy for many people, especially if they're carrying to 38, 39, 40 weeks, because those muscles can only stretch so much. At the same time, though, we want to see, well, if you take a nice full breath as you move through that posture, or if we make it a little bit easier, we provide some support, we offer a variation or a modification. Can we limit that doming or coning, kind of that distortion that we see in the front of the abdomen? With diastasis, I did want to mention that it is different than an abdominal hernia. So oftentimes during pregnancy, someone will see a change at their belly button where their innie is now flat or an outie. If there is something that is truly like popping out around the belly button, that can be an umbilical hernia. So a hernia around the belly button or the umbilicus. That is different than diastasis or diastasis, but they often co-occur. So if someone has an umbilical hernia, I'd say I often see that they also have a diastasis. All of the same tips apply. We're still working on breathing, working on good posture and mechanics, limiting things or modifying activities that cause that hernia to pop out or cause pain in that area. So, in summary, no amount of pain in pregnancy is normal. Our pregnancies we should feel physically quite well. If you're experiencing aches, pains, if your students are, it's a sign that something is weak, tight, tense, something isn't moving well, or it's not strong or stable enough to support all of the extra load that's on the body during pregnancy. And this is where a movement practice like yoga can be beautiful in helping someone gain mobility, but also strength and support so that those muscles have the ability to support the extra demand that's on the body. As I mentioned with pubic symphysis pain, while many of these aches and pains go away once someone has given birth, sometimes immediately, oftentimes within a couple of weeks, it's still a sign that there's some level of imbalance or dysfunction in the body. So if someone is planning to become pregnant again, that pain often comes back sooner and stronger. It can also pop back up later in life. So pregnancy, it kind of shows us these weaknesses and these imbalances that are within our body. And if we're able to listen to that and see, can I pay attention? Can I fix some of these areas of weakness or tightness? We can feel a lot better just throughout the course of our life. Okay, so moving into birth. So as I mentioned in the very beginning, this is very much just meant to be an overview of how the pelvis shifts and changes during a vaginal birth and labor. So to start off, I wanted to orient you a little bit to the different areas of the pelvis. So if we're able to look at the picture here, at the very top where that yellow circle is, that's the inlet of the pelvis. So that is basically our top opening here. Then where the green shape is, that's the mid pelvis, and it's in line with what we call the ischial spines. So a certain level in the sacrum. And then the outlet, as you may have guessed, is the opening at the bottom here, also indicated by the blue shape in the picture. I chose this picture because it has the stations of the pelvis listed, depending on your nursing team, your midwife or OB team. If you're choosing or they're doing cervical checks, they may mention, oh, the baby's high in the pelvis, the baby's station 2, station 3. And that's telling you that the baby hasn't yet entered the inlet, or they're just in the inlet. Whereas if they're at station 0, then they're right in the middle of the pelvis. If they're at that positive 1 and beyond, then they're in the outlet, or they're entering the outlet of the pelvis. So some of you may be doulas that are taking this. You're probably very familiar with this, midwives, other people that are part of the birthing team. Why I included this is so that some of our yoga postures that we use to open the top of the pelvis or the bottom of the pelvis, they can be helpful during labor. So if the baby is stuck high in the pelvis and they haven't entered the inlet yet, maybe they're stuck on the pubic bone, maybe the pelvic floor is really tight, or the abdomen quite often is very tense. The baby is stuck up high, and what we want to do is find movements that help open the inlet first, that top part of the pelvis, so that the baby is able to clear the pubic bone and drop into the pelvis. For some people, this happens during labor. For other people, it happens during pregnancy, where all of a sudden you feel like the baby has dropped. There's a lot more pressure on the pelvic floor or pressure on the rectum. Someone might feel like they can actually take a deep breath, or a little bit more of a breath again, because the baby isn't sitting as high in the rib cage, compressing the diaphragm, not allowing the lungs to fill quite as well. So when we think about how this impacts our yoga practice and how we can bring our yoga practice into labor and birth, we first want to think about pelvic inlet. So while someone is pregnant, things that move you into posterior pelvic tilt, so where your pelvis is kind of rocking posterior, rocking back, your tailbone is tucking, those are movements that can help the baby drop into the top of the pelvis. During labor, things like holding that cat back, or even a seated cat-cow, or a standing kind of version where I just tuck my pelvis under during a contraction, especially for providing a little bit of support under the abdomen, lifting the front of the abdomen as you roll the pelvis under can help the baby clear the pubic bone. So having that mobility, feeling safe in your body to round, to arch, so that in labor, someone has that freedom of movement and those movements feel comfortable and they can trust what they're feeling in their body, can be really helpful. Moving down the pelvis into the mid-pelvis. If the baby is stuck in the middle there, oftentimes things that help to relax the pelvic floor, open everything at the hips and the sacrum can be really helpful. One movement that I really like for this is a little bit of a diagonal lunge. So if we think of modifying our warrior 1, our warrior 2, taking a wider stance as you lunge forward and back, shift a little side to side, coming onto that diagonal, whether it's right foot forward, left foot forward, can help open everything in the middle. Things that help to relax the pelvic floor, like taking those nice full breaths, coming into positions where the hips are in internal rotation. So your knees are more in line with the body or closer together, and your feet are out, can also help open this area. One of my favorite things to do in a yoga class when I'm working with a group of pregnant people is a little bit of hands and knees rocking. So I have people come into a hands and knees position. First, just with their knees in line with their ankles and their feet. So you think of your traditional tabletop position. And just see if I keep my tailbone lifted, so I keep that natural arch in my low back, and I rock forward and back. As I breathe in and rock back, what do I feel happening at the sit bones? What do I feel happening at the tailbone? Do I feel any movement or any stretch at the pelvic floor and the sacrum and glute area? Now, how does that change if I keep my knees where they are, but I kick my feet or flare my feet out to the sides? So I bring my hips into intramural rotation. What we're hoping to feel there is more stretch, more lengthening between the sit bones, so at the area of the pelvic floor and the tailbone. So you're opening the mid pelvis as well as the outlet there, versus if I want to open more of the inlet, the top of the pelvis, if I bring my knees wider than my hips, or I bring my feet together, then everything's going to close off at the bottom at the sit bones and the pelvic floor and open up at the inlet or the top of the pelvis. So taking that movement to allow your student to feel, here's what happens when my knees are in line with my hips and my feet. Here's what happens when my feet are out. Here's what happens when my knees are out. That way they can feel the changes at the butt bones, at the sit bones, at the tailbone, and the pelvic floor. So if they're feeling a lot of pressure in one area of the pelvis, or labor is slowing or stalling, saying, well, what happens if I change those angles and those pressures and open different areas of the pelvis? Is that the space that the baby needed? And then finally, we have the pelvic outlet. So when we think about the outlet or the bottom, that's the space that is traditionally thought of as the pelvic floor, the area between the sit bones, butt bones, and the tailbone. So when it comes to opening the pelvic outlet, things that bring us into a little bit of an inversion, so a downward facing dog, we're allowing the sit bones to gently open, spread apart, a variation of puppy pose can all be a really nice opening option for the outlet. So if the baby is sitting really high in the pelvis, you're changing that position, coming into a gentle inversion and then shifting back out of it to basically give the baby an opportunity to reset, can be really helpful. As you might have guessed, moving into opposite positions that from what opened the inlet, open the outlet. So if a posterior pelvic tilt, rolling my pelvis back, tucking my tailbone under, opens the top of the pelvis, then doing the opposite, so arching my low back, lifting the tailbone is going to open the outlet or the bottom of the pelvis. So this is where, when we get into pushing here in a couple of minutes, this is really important. We don't want necessarily to have the knees far and wide out to the sides, what we think of in any Hollywood movie that I've ever seen where someone is laboring and pushing. They've got their knees way up towards their shoulders, knees are far out to the sides. That's opening the inlet instead of opening the outlet. So seeing, again, with that rocking, with cat-cow, with a child's pose, can I notice what I feel in that sit bone, butt bone area, so that when it's time to push, I feel confident in feeling that the outlet is open, the pelvic floor is relaxed, and that baby is able to enter the world. So little things here for standing and opening the outlet can be something like a squat, allowing the knees to come forward over the ankles. So think of a modified chair. You are, again, opening those sit bones, opening that outlet. I like to have people feel this in hands and knees, lying on their side, in standing, because they may feel really strong, really powerful in any one of those positions. And what we are hoping to do through our yoga practice is allow them the mobility, allow them the strength and the support so that they are able to listen to the needs of their body and move with what their body needs throughout their labor and their birth. So, moving from more of a traditional labor and vaginal birth mindset into thinking a little bit about cesarean birth. So, in the US, 1 in 3 births are cesarean births. Some cesarean births are planned, and this is in the US often because of a breech birth, a multiples pregnancy, if someone has had a traumatic birth experience before and they may opt to have a cesarean. There are certain medical conditions, all kinds of reasons to plan a cesarean. Those births tend to be a little bit different than an unplanned cesarean. With a planned cesarean, you know that you're planning on surgery. You know that you're planning on recovering from surgery. You may have had the chance to speak with your physician or speak with, members of their team to talk through options of, can we use a clear drape? Can we do immediate skin to skin? With a planned cesarean, you are probably medically stable and you are walking in at a certain time and things tend to go quite smoothly. People that I've worked with that have had planned cesareans, many of them say, I don't know why I'd ever do it another way, because they felt like it went very smoothly. An unplanned cesarean can be a very different experience. People still can recover incredibly well and have a fabulous postpartum experience, but they weren't going in that day thinking, I'm going to have a major abdominal surgery. So for some of us who are working with people postpartum, teaching a postpartum yoga class, their birth, whether it's a vaginal birth, a cesarean birth, may not have been the happiest day of their life. It may have been quite traumatic. So being able to hold a little bit of space there for those people. And then knowing postpartum, if I had a major abdominal surgery, that scar tissue, it may not move as well as my muscles and my connective tissue before that surgery. So things that do allow a little bit of a gentle stretch on the front of the abdomen, things like gentle back bends, even something like a bridge where you're getting a little bit of a stretch on the front of the belly. Things like cat-cow, it might feel good. It might feel really tight to start off with. So if someone is noticing a lot of pain, a lot of pulling, and you know that they've had a cesarean or it's something that they mentioned, easing into those positions. If it's something that's causing them a lot of pain, a lot of tightness, if they feel like their abdominal muscles just aren't quite supporting them anymore, if that's not something that you are able to cue to address, something that you're not able to modify, it's a great option for a referral. So with that, just whole idea of planned versus unplanned, keeping in mind many cesareans are medically necessary. It is a life-saving procedure, but there are also some times where it is more the result of a cascade of medical interventions. So that's where that whole idea of being able to hold space for your students. You may have someone who's pregnant with their second or third, and their first was an unplanned cesarean, and now they're weighing their options of, do I VBAC? Do I have a vaginal birth after cesarean? Do I plan a cesarean? They may be second guessing some of the interventions from a previous pregnancy. So that's where being able to hold space, know the doulas in your area, work with the team to be able to guide people, because they're often coming to class once a week and they're seeing you regularly and they're trusting you. So being able to kind of guide people into an experience that may be a better outcome, whatever that looks like for them, can be a really wonderful added bonus of building these relationships with our students. And then just keeping in mind that a cesarean is a major abdominal surgery. They're going through several layers of skin, fascia, different types of connective tissue. They are spreading the muscles of the abdominal wall. So these are multiple layers of tissue that they are making an incision through and opening up in order to bring the baby into the world. They are making that incision through the uterus as well. So when we think about recovery postpartum, this person is going to need to have a lot more passive support at the abdomen, whether that's high-waisted leggings, an abdominal brace. They're going to need to take it really easy to allow that incision to heal. And it's not just the wound that's on the placenta or any tearing along the perineum, or if there was tearing along the labia. So keeping that in mind, if someone is early postpartum in a class, that this was a major surgery. Okay. So circling back a little bit to labor or a vaginal birth, thinking about our breathing and finding that distinction and that difference between diaphragmatic breathing or belly breathing. So just as a refresher, the diaphragm is up high in the rib cage. So if I'm breathing with my diaphragm, if you're breathing, you have to use your diaphragm. You are allowing the rib cage to expand or open up out to the sides. So I like to picture an umbrella. As that umbrella opens, so as I breathe in, the rib cage opens. Now the abdomen relaxes here, but I'm not pushing my belly forward to take a deep breath. That's more of a belly breath. That's not what we're using here. So as I breathe in, I'm thinking about keeping my jaw soft. That's allowing the vocal cords to remain soft. I'm inhaling, allowing everything in my rib cage to expand, the abdomen and the pelvic floor just stay relaxed. And then it's just a nice, soft exhale. So when we think about breath for pain management, diaphragmatic breathing can be beautiful. When we think about just how that relates to managing pain or managing contractions overall, thinking about the connections between the muscles of the jaw and the vocal cord. The vocal cords are a mirror image of our diaphragm and our pelvic floor. So if I'm able to keep my jaw, my neck, my shoulders somewhat mobile and somewhat relaxed through a contraction after contraction while I'm laboring, it's a good indicator that the pelvic floor is in more of a relaxed state. So this is where in my classes, I like to cue, can you let the bottom jaw drop away from the top jaw? Can you let your tongue drop away from the roof of your mouth? Can you find that softness in your jaw, in your face, your neck, your shoulders, and let go of that tension and that effort at the pelvic floor? One thing to be mindful of here that I might mention in my class is when it comes to pushing, if I hold my breath, or I take a really big breath in and then I push as hard as I can, holding that breath, that's not allowing movement at the pelvic floor. Versus if I'm softly exhaling as I push, the pelvic floor is able to stay relaxed. Everything can more easily stretch. So when we think about labor, especially if it's in a traditional hospital setting with coached pushing, they're often telling people, now take a really big breath, hold it, push as hard as you can. Well, let's do that twice more. And what we're doing there is creating some tension at the pelvic floor and then trying to just overpower it and push past it. So seeing, can I use that soft exhale, that pant, to keep the pelvic floor relaxed as I push. Also noting here that low pitched sounds, so like our like a low hum, can help relax the pelvic floor versus a really high pitch causes tension at the pelvic floor. So for some people, being really vocal is really helpful, and kind of you can clue into that with your practice if you choose to begin or close your practice, bring everybody together by using a vocalization like an om, having people notice how that initial O sound creates a little bit of downward pressure at the pelvic floor, and then that low keeps the pelvic floor relaxed. So that can be a really fun way for people to feel that change in their body. And then when they are laboring, when they are pushing, now they might not use an om per se, but being able to use those low pitches feels really familiar, and it can feel more comfortable. And they're able to trust that their intuition and those instincts and use that to their advantage. Okay. And then wrapping up here with postpartum. So this is meant to really just be a brief overview of postpartum, certainly not inclusive of everything that happens postpartum or everyone's postpartum experience, but just some general guidelines. One thing that I talk about with all of my clients, all of my students, is truly the ideal world. What would your postpartum, your first 30 to 40 days look like? In other countries and other cultures, people are taken care of in a different way postpartum. So that ideal world, those first 4 weeks, it looks a lot quieter and it has a lot less activity than many people in the US. What they do, whether that's by necessity, because of the setup of their life, or this kind of cultural expectation that we have, where people are just supposed to bounce back and jump right back in. So when we talk about that first month or so postpartum, ideally that first week, you are working on co-regulating. So you are in the bed or on the couch, spending time with baby. They have spent their entire life hearing your heartbeat, feeling your warmth, hearing your voice. So for many babies, being separated is very challenging. Of course, there are those exceptions, the baby who is just set in their bassinet and just wants to be left to their own devices. But even if that's the case, taking that time to slow down and rest. The placenta, the organ that your body grows to support the growing baby, it creates and it leaves a wound on the inside of the uterus that's about the size of a plate. So if you think about, a good sized wound on the inside of your body, getting up, moving, going up and down the stairs, trying to, walk blocks and blocks early on postpartum can extend how long it takes for that wound to heal. So that first week, you are working on healing, you are resting, you are co-regulating in an ideal world. Little things that I like to throw in with my clients, with my students, can be just a little bit of mindfulness around this, of who are the support people in your life? Who are the friends, the family members that you can call in to see, can they do some of the lifting? Can they do the up and down the stairs? The things that you should really be limiting early on postpartum. Even little tips like, okay, what room do you plan on spending that first week or two in? Is it the living room? Is it the bedroom? Now, is there a bathroom that's close by, or would you have to go up and down the stairs? Is there the kitchen or a little fridge, a little basket, something that has what you need right there? Can we stock that well for you so that you're able to lie down and rest? So that first week is in the bed. Second week ideally is in the room. So still not a whole lot of movement. We're co-regulating. We're healing that plate-sized wound within the body. If you had a cesarean, you're letting those tissues heal. And that healing, it takes time. Week 3, we're thinking more around the house. So now instead of maybe up and down the stairs, once a day, a couple of times a day, we're still not ideally, lifting toddlers, carrying them up and down the stairs. We're not lifting them in and out of cribs. If I need to carry the baby in its 40-pound carrier, is there someone who can do that for me to bring them to their doctor's appointment? Who is in my network that might be able to help me with those physically heavier tasks? That way my body can focus on healing. Week 4 is more around the block. So you're getting out more, you're moving a little bit more, but you're still not trying to do everything that maybe you once did before. So these are little things that can be woven in to maybe some conversation that you have with your students at the beginning of the class, or as everybody's kind of lingering and mingling after class. Just a little checklist item of, hey, this week, what's one way that you can plan for postpartum? Do you have a meal train? Are you, prepping freezer meals? Have you called your aunt to see if she can still come into town? Those little things that really, really go a long ways. Because many of our students, they might not be able to hire a doula. More and more people aren't necessarily even taking a really good childbirth education class where they're hearing this information. So if they haven't given birth before, they don't have friends that are in that period of life, they don't have another person in their life who is just stepping in to take care of them, they often need sometimes that permission to ask for help and seek help and say, here's what I need so that my body can focus on healing and I can focus on bonding with my baby. So from a cesarean birth perspective, just keeping in mind that healing along the incision. Some people feel amazing. Like I said, many of my people who have had a planned cesarean can't believe you would ever give birth another way. Others, they feel awful. They have a lot of nerve pain, a lot of tenderness. They have trouble getting in and out of bed. So it varies a lot with cesarean births and vaginal births as well. But no matter how someone gives birth, resting as much as they can in those first 30 to 40 days, using good body mechanics, providing a little bit of abdominal support those first few weeks to allow the body to heal. A couple of other just common postpartum concerns. Many of the postural changes that happen during pregnancy are exacerbated postpartum. So thinking about opening the front of the chest, standing tall, finding good posture, using good support so that you are able to feel good and well throughout your body. There are so many large hormonal shifts in this postpartum period, especially those first couple of weeks. So keeping your body moving gently, taking the rest that you need, getting the nutrition that your body needs, staying hydrated, it all goes such a long ways. In the very, very early days postpartum, many people experience urinary urgency and incontinence or leaking urine. So racing to the bathroom, not quite getting there in time. Those first few days postpartum, I don't worry about this at all, especially if you had a vaginal birth. But if this is lingering more than a month, more than 2 months postpartum, or it starts happening during pregnancy where you're leaking urine, this is something that can be treated through physical therapy. So just keeping that in mind, that if someone is in your postpartum class and they don't feel comfortable doing something because they are leaking urine or they feel like they're going to pee, just having that in the back of your brain, that this isn't something that anyone has to live with. Crossing your legs and saying a little prayer isn't the only option. I also wanted to mention pelvic organ prolapse, which I think is something that is getting a lot more attention now than it did even just a few years ago. A few years ago, I was hearing a lot from my clients or my students that their OBs didn't believe them that they had pelvic organ prolapse because it was just something that happened to old ladies. But with pelvic organ prolapse or POP, what it is this extra mobility throughout the organs of the pelvis. So that can be the uterus, the bladder, the rectum, where instead of sitting up nice and high in the pelvis, they're drooping or they're dropping down. So people can feel a lot of pressure, heaviness. They might feel a little bit of a bulge or a lot of a bulge. So one thing that we're able to control with POP or pelvic organ prolapse is someone's pushing mechanics and the rest that they take postpartum. There are a lot of other factors, but if someone is able to push for, 40 minutes to an hour versus pushing for 4 hours, they aren't constipated during pregnancy or right away postpartum. They take the rest that they need, so there's not all of this extra pressure on this area that just went through a whole ordeal. We're able to impact how those tissues heal so that people aren't experiencing as much of that heaviness or pressure or bulging feeling. So if someone is, again, in your prenatal class or postpartum class, and they're feeling a lot of heaviness or pressure, there might be something that they can do about it. Sometimes it's as simple as taking some nice full breaths, letting the pelvic floor support the body. Other times, it's a great option for a physical therapy referral as well. So little things just to have in the back of your mind, because you will be a trusted resource for your regular students. So with that, the very last thing I have here is postpartum exercise. So again, not meant to be a deep dive into this, but knowing that the clearance or the okay that is given at 6 weeks postpartum or 8 weeks postpartum is only talking about tissue healing. It's saying that that wound from the placenta has healed, you've stopped bleeding, the perineal tearing that can happen, or the incision from the scar tissue. It's saying that at the most basic level, those tissues have healed, or at least they're mostly healed. That doesn't account for the pelvic floor trauma that may have happened. It can take up to a year from the time that you give birth, whether you had a vaginal birth or a cesarean birth, to kind of bring the opening back to its prenatal size or width. The abdominal wall was stretched. Those muscles are probably on the weaker side compared to before the baby was born. Your breathing mechanics from having the baby press up and out of the ribs can be changed and altered. So starting there, seeing, can I take those nice full breaths? Can I connect with my breathing, with my abdomen and my pelvic floor again? It can be a beautiful thing to start with before jumping into trying to participate in a very active class or try to go for a run or lift something heavy, starting with building back that foundation with your breathing, with good form, with any movement choices, and then just good body mechanics overall. So, like I said, a lot of this was meant to be a summary of birth, of postpartum, just things to keep in mind with your students, as you will be a trusted resource for many of them. So if there are any questions, here's my email address, here's my Instagram. If there's anything that I can answer, feel free to reach out.
Thank you, Lauryn. That was a whole load of information. It's great. And I do actually have some questions I think you covered. Because I as well have a webinar in this training for common aches and pains. You're focusing just on the pelvis, so that was great. So I can actually, in my presentation, focus more on things that are, although most of it's happening in the pelvis, right? We have some other things going on as well, like, you know, reflux, right? So talking about like digestive stuff or circulatory stuff or cardiovascular stuff. I was curious, in terms of, so you spoke about returning to yoga practice around, did you say 6 weeks was about when most people might feel comfortable returning to a yoga practice?
So I'd say it varies a lot person to person. That 6 week timeline is kind of what the medical community really looks at as basic tissue healing has happened. Full tissue healing can take 12 to 16 weeks. So 6 weeks is kind of that bare minimum. You shouldn't be bleeding anymore, and you're at a decreased risk of infection. Some people choose to move much earlier. I really, really encourage that first month, those first 30 to 40 days, taking it really easy, working on breathing and resting and just bonding. I've had people who've shown up to class much earlier. Some have done the due diligence of checking in with their medical provider, others haven't. So to a certain extent, using your best judgment and keeping in mind what someone's needs might be. If I have someone in my class who's 6 weeks postpartum or 4 weeks postpartum, we're working on breathing. We're doing very gentle movements. It's very possible that they are doing much more at home, especially if they have a toddler or an older child. But I'm still going to choose movements that are appropriate for where they are in their healing timeline, even if they say, oh yeah, I went for like a 2-mile run yesterday. And I'm like, you gave birth 2 weeks ago. Why are you doing that to yourself? In my class, we're still going to choose to really slow things down and honor where their tissues are, because we can't rush tissue healing.
No, you cannot. Right, that takes time. I think for the medical community, we get about the time range we hear of commonly is 6 to 8 weeks, again, depending on how you're feeling. And then with a C-section, longer, obviously, because you're healing from major abdominal surgery, as you pointed out. And also that incision is healing. That might be more like closer to 10 to 12 weeks, maybe longer. If someone is coming to class that has given birth via C-section, you know, what can we expect in terms of discomfort around incision, even after that 10 to 12 week period of time? Can you enlighten us a little bit about that?
So I'd say, like any postpartum experience, there's a lot of variability. One very common theme is feeling numbness or feeling disconnected from the incision site, from the lower abdomen. When the baby's born via cesarean, they have to separate those tissues and those muscles, and they aren't going to be exactly the same as they were before. Now that there's scar tissue there, that's helping to support the area. So feeling numbness, feeling incredibly weak, incredibly disconnected, I'd say are some very common themes. I also hear a lot about, oh, well, it just kind of pulls or it tugs. Sometimes that's very mild. And as the scar tissue starts to stretch and we start to engage those abdominal muscles in a better way, that goes away. Other times it feels really deep and really sharp. And that's a good indicator that they would benefit from seeing someone who can do some soft tissue work or doing some soft tissue work themselves.
Right, to work with the scar tissue. So, obviously some poses are going to feel better than others if we're healing scar tissue.
Yes.
Right. So maybe we're not guiding them into back bends or anything that stretches the front of the body, or or maybe contorts the torso as much, because that is going to work with that sensitive part of the body. Okay, that's helpful. Okay, great. And then in terms of some women who are giving birth vaginally, they may have stitches.
Mhm.
Right. So we have to wait for those stitches to heal. Obviously, we're waiting for bleeding to stop, but then that can be a very sensitive area as well. So I guess I'm answering my own question. It's just case by case, and working around those poses that might cause discomfort in that area.
Yep. So
Right.
just as
You
you
wanna-
mentioned with back bends after a cesarean birth, you might feel that tugging or that pulling. A gentle, back bend of sorts like cat cow might feel great. A bridge where you're getting a little stretch on the front of the abdominal wall might feel great as a gentle stretch to that cesarean scar. Same thing if there is a scar at the perineum or some tissue tightness throughout the pelvic floor muscles around the labia and the vulva. For some people, a gentle stretch, focusing on their breath, letting everything stretch and move, might feel really good. Other people are going to feel really vulnerable and really open in that position, where they might feel a lot of pressure and a lot of heaviness. So, this is where I really cue my students to pay attention to what you are feeling. Does this movement feel good in your body, in this new version of your body? Or would it feel better to take a narrower stance? Would it feel better to, use some blocks for support, or let's use a strap for bolsters? Let's use some support here so that I can meet my body where it is and not try to just push past something that doesn't feel good.
Mhm. Yeah. And it's tricky too, because in our group classes, we invite both pregnant and postpartum folks to join us. So we're kind of managing both those populations that have very, very different needs. And so I think that's one of the main things we teach our teacher trainers is to, yes, empower our people to do what feels right and move away from things that don't feel right. And what feels right today might not feel right tomorrow. So I feel like we're constantly building that sense of a self-awareness in our students, so they can be empowered themselves to do what's right in any yoga pose, depending on what's going on. Someone, I forgot who it was, who said, once you give birth, whether it's vaginally or C-section, your body is postpartum forever. Right. It's like our bodies, it is that new version of our bodies, and learning how to befriend that new version can take a while.
Mhm.
And we're healing for a long time too. And I think it's hard for a lot of women in our culture, because we have this very fast-paced culture with high demands, and it makes it even more difficult that when we do have our babies, to slow down, to stop, and to take the time to heal. So I think that message needs to be reiterated over and over and over again, because it's just not taught in our culture. So I love the week 1, week 2, week 3, week 4. Like week 4, you're just going around the house, where like week 2, I'm seeing brand new babies in shopping malls.
Mhm.
Right? Maybe week 1 or week 2, I'm seeing folks out and about. So I think the more we can share that with our folks in our classes, the better, because I think people need to hear that over and over again to let it soak in. So thank you. Thank you for driving that home. And it was really great to see that week by week by week.
And that is kind of exactly why I included it here. Because I don't think it's said enough. But also for many of us who some of our support people, like my mom, she grew up in a different generation, obviously, and her ability to, slow down was impacted by support, lack of support. So this need to just push through and overcome in all aspects of life. Um, Her experience as a newly postpartum mom will could influence my experience. I'm counting on her as a support person. So if I know, okay, just from a tissue healing timeline, like my body needs this support and I need to take it easy, that can honestly help guide some of those conversations when, you know, uh, mom, a grandparent is encouraging you, oh, just get up, you'll feel better, just get moving. Or like, oh, well, when I gave birth to you, it's like, well, we know more now. So let's do better and support people when they're pregnant, especially those early postpartum days. Could be a whole soapbox, so I won't go down that tangent, but giving people that support and giving them some of that knowledge and information so that they're able to have conversations with the people that love them and care about them so that they do heal in all ways, shapes, and forms.
I do think it's especially important with our first timers too, because they don't know what's coming. They don't know. So right. And I find many of my clients who are expecting are a little suspect of that. Like, really? I'm going to need to lay in bed for a week? Like, what is this? What is exactly going to happen? They don't know. So it is really important to keep driving those concepts home. Well, this was so helpful. And again, everyone has your contact information if they want to get in touch, if they even want to refer students to you, if they are having pain, if they are having discomfort. I think it's really important that you laid out that pain is not normal. It's common, but it's not normal. It is a sign that something is up and something needs to be addressed. It's not something that's like, oh, aches and pains are just part of pregnancy. They are, and they need to be addressed. So if any of our folks have people that they're working with that are having pain, and if they're in the Milwaukee area, hopefully they can find you. Right, the conversation will continue. We'll have to find out how we can have you back again, Lauryn. This is so interesting. Personally, I would love to see how this unfolds in how this shows up as a yoga practice. Right, especially I loved all the postural cues around birth, in the baby's position and the pelvic. So I'd love to see how this can be more embodied in a yoga practice. So maybe that's our next conversation.
I think we can make that happen.
That would be wonderful. Well, thank you again, Lauryn. This was wonderful. Thank you for sharing all of your wisdom with us. I'm going to stop recording now. So if everyone's watching the replay, thank you for joining us. You can comment in the class module if you have any questions. Lauryn, we need to get you in the classroom, so maybe you can see some of those questions. So there's a quiz to be taken. I hope you've taken good notes, and we also have Lauryn's slides so you can look through those, and we'll see you next time. Don't forget to check out the stream in the classroom about upcoming webinars. I'm going to stop recording now, and I'll see everyone soon. Thanks for coming.